Hello, all. This is Dr. Dheeraj Masapu. I'm a consultant neuroanesthesiologist, and so in the modern day medical practice, to become successful is very competitive, very difficult, and only I can say that 5 to 10% of the people will be successful. So I have made a list of 7 qualities that I have actually picked up from very successful doctors, and these 7 qualities are the ones which I usually see in them. Okay, if you have these qualities, then it is just a matter of time you're also going to become successful. And if you don't have any of these, then if you don't have, then try to build these skills. Okay, number one is you need to understand that the medical practice and a medical journey as a journey in medical career is going to be a curved path. It's not like a straight path from path A to path B, point A to point B. It's going to be curved. There will be moments of success and failures and everything. So what quality I see usually in very successful doctors is that they always feel that they don't know few things. You have to accept that. So they always are unsure about some of the diagnosis. They take second opinions and they run a lot of tests, and they try to admit that their knowledge is limited, and they always try to actually open up saying that maybe I don't know this one, I have to take opinion of some other big doctor or some other investigation we have done. So this kind of mindset will be there. So they'll never be overconfident. That is one of the most important thing I have seen in them. Okay, so you should always have this quality of, maybe you have to think I don't know much, so maybe you have to read about that, discuss with some other consultant, and then come to a diagnosis for that particular patient. This is one of the quality I see. And second thing is, the most successful ones are not the book smart guys. They're not the toppers, or they're not the top rankers. They are emotionally intelligent. So for example, I'll tell you an example scenario. A young lady comes to emergency saying that chest pain is there, and then if you're a book smart guy, then what do you think is, okay, throw by Probi and PECG and run all the battery of tests. So a very emotionally intelligent person, what he does is he understands that particular age group is not for MI. So he will just go into more details about the case. He'll try to talk more with them and understand that it may be a sign of depression or anxiety or something. So what they usually have is they have that smartness, and they're more emotionally intelligent. They try to analyze in a different way than going according to protocols and books. That is another thing which I noticed in very successful people. Okay, and then the third quality what I see in them is the communication skill. Communication is not just talking in English. Communication, what they do is complex topics they try to simplify and tell to the patients. That is what they do. Even the most complex of the brain tumors are very tough to understand to the common man. They try to simplify that and put it in a very simple terms. So in that way, whatever language you do, you can do it in your mother tongue, you can do it in English, in whatever language you do. So they are actually very, very, very clear in what they tell, and they try to simplify that when they tell to a common man. So that is the third quality. So fourth quality is that they are very organized. Okay, it is not that it look like they're in urgency and hurry all the time, but they're very organized and they follow up with the patients. They even have a track of all the patients, and then they keep a check of whether this particular patient has gone for the particular investigation, whether this is done or not in the evening. If the MRI is done, then what happened to MRI, they'll follow up in that level. And also they keep a track of what is their success records and the morbidity delays and everything they keep. So they try to constantly improve themselves by having all the records, and usually they collect the data and then they publish their data and they go for several conferences. So they're pretty organized, and that is one of the quality I see. And fifth point is the empathy component. They are very empathetic. Okay, so they understand the suffering of the patient, and they talk as if they're treating their mother or father or a brother. So that is the most important quality I have seen in them. And they even hug the patients, and then they actually understand from where the suffering comes, and they never try to treat the disease. They always try to treat the suffering that the patient is having, and make the patient go home in a comfortable way, and also take care of the family who are also a part of the suffering. So they're so empathetic actually. So that is a very unique quality, and it needs a lot of energy and hard work to do this. It's not so easy as I told, and you have to develop that over a period of time. You'll get this component. and they always take feedback. It is not that they have done some surgery, they're going to leave it. They indirectly take feedbacks from the patient, like what type, they're doing some new type of procedure, what is happening to that kind of patient, whether the pain is decreasing or not, whether the particular tumor is debulking or not. All those things they actually take the feedback, and they try to constantly improve from the patient. If the positive feedback is there, and then even then they will take that positive feedback and they will actually analyze in their brain what kind of good techniques they have used in that particular patient, and they try to implement those things in their protocols. And the last quality and the seventh quality, what I've seen in them is the resilience or the hard work and that they put in, because the successful ones have to go through a lot of stress, and the medical profession is very demanding nowadays. And then so the situations are changing, protocols are changing, new drugs are coming, patient demands are increasing, and the family demands are increasing, and body's overall frailty and fragility is increasing, and the comorbidities are increasing. So treating a patient is very challenging nowadays. And also you have to, if you're working in a corporate hospital or a big institution, they will also check the revenues that you're generating. There's so many aspects to that. So they keep up with all those things and still they'll be smiling, and that is one of the important quality that they have. So they're resilient, and they are like very, very, very what do you call it, hardworking people. So these are the 7 qualities I have seen in very successful doctors. And if you really have these qualities in you, and I think the universe is telling you that you just need some time, and you'll also be successful in future. Okay, thank you very much. And as usual, Dr. Dheeraj Masapu logging off. Roger that.